A normal heart rate for a dog would be about 60 to 160 beats per minute, and sometimes with smaller breed dogs, that heart rate can be a little bit higher. To determine the heart rate, you can count the number of beats that you hear in 15 seconds, and then you can multiply that by 4. A normal respiratory rate for a dog can be about 16 to 32 breaths per minute. An abnormal heart can have abnormal pulses, murmurs, which kind of makes a sloshing sound, or arrhythmias. Abnormal sounds to hear in the lungs could be wheezing, which is a sign of bronchial disease, or crackling, which can be a sign of a pulmonary disease. You can also hear absent lung sounds, which can be a space occupying problem. Okay, so I'm going to list the 4 chambers of the heart: the right atrium, the right ventricle, the left atrium, and the left ventricle. Okay. So to properly position the leads for an ECG, the patient needs to first be in lateral recumbency with their legs perpendicular to their body. When doing an ECG, you should stay away from other electrical devices to avoid a mechanical or electrical interference. So for this rabies restraint pull, how it works is you pull back on the handle, and when you do that, this tightens. When you push back onto it, it loosens up the noose. And then once you have it tightened, you'll turn it and it locks it. So we'll demonstrate it on a live animal now. So for this demonstration, I'm going to use my dog. I'm going to push the end of this rabies pole, and I'm going to keep a safe distance but wrapped around her neck, and then I'm going to pull back to tighten it. Once I have a good grip here, I'm going to unlock it by twisting it the other way and pushing to release the noose. And then there we go. So this device is not only used for rabies suspected animals, but it can also be used for very aggressive dogs. It allows you to kind of have a good hold and restraint on them, but also from a safe distance. So when free catching urine, you want to try to collect it in a sterile syringe or a type of clean plastic container. So I'm going to do free catch urine, and I want to do it in a clean plastic container, and I want to catch it midstream.
Gosh. Uh-oh.
You're in midstream so that the urethral opening doesn't contaminate the urine. So now we're going to disinfect a cage. So the first thing you want to do is remove any towels or blankets that are in there and throw them in the washing machine. And then after that, you're going to remove any organic material like feces, urine, hair, anything else loose in there. You want to get rid of that before we start doing the actual cleaning. So when cleaning the kennel or the cage out, you can start off by doing a general cleaner that we have in this spray right here, or you can do some soap and water, but this is just the general cleaner to kind of start out the disinfecting process. So we'll just kind of clean off that hair and foreign material that was all in here. So after spraying that, we're kind of going to rinse it all out. I'm going to wipe it first, now we're going to dry it off, and we're going to do that to all sides of the kennel, and we'll do that to every side before we do the disinfectant. Now we're going to apply a disinfectant, and you're going to allow this to sit for a good 10 minutes. So then I applied and spread around the disinfectant throughout the whole kennel, and we're going to let that sit for a good 10 minutes. After the 10 minutes over, we are going to take a type of damp cloth, and we're just going to wipe all of it away to make sure that there's nothing left remaining. And then I'll usually grab another type of hand towel or cloth and just dry out the rest of the kennel.
Push it through. Keep going. Interior, you just have air leak. Sure. So. Good. And pull it out. You did.
So when doing the cysto, the doctor is going to palpate the bladder, apply alcohol onto it to sterilize it a little bit, and then you're going to insert a needle with a syringe into the ventral body wall of the bladder. So once the doctor is in the bladder, she's going to aspirate the urine directly into the syringe from the bladder, and this way it avoids the effects of urethral contamination.
Stretch his legs. You're all right, kitty, kitty.
It's okay, Blueberry.
You got a really full bladder, so that might be broken.
It's okay, baby. It's okay. It's okay, Blueberry. So sorry, honey.
Okay, so I'm going to do a Schirmer tear test that tests the tear production rate. So I'm going to place this in his lower eyelid and let it come in contact with the cornea. I'm going to let it sit for a minute.
Good boy, Charles. Good boy.
A normal tear production rate is between 15 and 20. Anything 10 or lower can be dry eye.
Good boy. There you go. Good boy.
Okay. There's one. Okay. Okay, there's two. And three. There's three. Perfect. Thank you. Okay, so next I'm going to do a fluorescein stain, but first I'm going to put a drop of the proparacaine to kind of numb the eye.
Good boy.
Okay, so next I'm going to place the stain into the eye. And then I'm going to turn off the lights and turn on the black light.
Okay.
And if there was any scratches or ulcers, the stain would take up and show a bright green dot or spot in the eye. But his is normal. So next I'm going to flush the eye out with this eye flush, and then I'm just going to wipe away the excess stain. Okay, so next I'm going to do an anal gland expression. I'm going to put some gloves on with some lube on my index finger. The anal glands are located behind the anal mucosa at 5 and 7 o'clock. So I'm going to slide my finger in. Feel for the anal glands, and then I'm going to gently slide my finger up to express. So when doing a warm water enema, we're going to have our warm water right here, and then we're going to have this little catheter that's going to go into my patient. I'm going to have a syringe filled with the warm water attached to the back of it. I'm going to have some lube here that I'm just going to apply just a thin film of it over the end of this catheter so that it slides easily into my patient without her being too uncomfortable. And then once I push this, it's going to send the warm water through here and through the slits that I made here at the end of the catheter into the patient. So I will go grab her, and then we can demonstrate how we would do that. So this is when I would gently start to slide the catheter into the anus right here, and then I'll flush it out with this syringe. Okay, so next I'm going to apply a topical medication. It's called Revolution, and so I'm going to push it down to make a hole in it. Okay, so then I'm going to part the hair high up so that it's out of the way for them to lick. And then I'm going to place it directly on the skin. There you go. Okay, so I'm going to flush out his ears by tilting his head over, filling the ear canal up with the ear cleanser, and I'm going to massage it in there. Let him shake it out. Take it out. Okay, then I'm going to grab a piece of gauze or tissue, and I'm just going to wipe out all of that. Oh, wow. All of the debris that gets brought up into the outside and beginning of the ear canal here. And then I'm going to take my ear ointment or Monetamax, and I'm going to stick it into the ear canal. Stick the long skinny end right into that opening here. Give it a good squeeze. Then massage it in there. Done. Record. Okay. So subcu fluids. Just gonna lift up the skin here, make a tent. Turn it on. And I'm going to go till I get the exact amount I need. I'm going to turn it off and pinch, hold the hole that I made there. That's it. Next I'm going to do a canine nail trim. So I'm going to start off clipping just the tips, and then I'm going to keep trimming back until I see a dot start to appear. The bigger it gets, the closer it is to the quick. So there's the dot right here. Dot right here. Do one more. There's the dot. And then if you quick it or you get it too close and it starts to bleed, you can use a quick stop powder, or if you're doing it at home, you can use flour. Okay. Okay. Kitty. 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 He's done. So I'm going to start off with a pressure bandage, an abdominal pressure bandage. So I'm going to place it on the fake laceration, and then I'm going to apply the vet wrapper, additional dressing, tightly wrap it around the patient, and I'm going to do layers of this to prevent any leaking. Then you can apply extra bandaging. So that there's multiple layers. Okay, using white bandage tape, I'm gonna place stirrups on the distal third of the limb, overlapping the toes and end of the leg. Just let it steady. Okay. Then I'm going to wrap the leg lightly with cast padding, starting at the toes, moving proximally, overlapping the bandage about 50%, trying to get 2 layers of padding. Next, I'm going to wrap the leg tightly with this conforming bandage, starting at the toes and moving proximally. Start down here. Okay, I'm going to overlap the bandage 50% to make sure the toes are still visible. Next, I'm going to separate the tape stirrups, rotating them proximally and securing them to the bandage, creating a barrier, preventing the bandage from slipping down. Then I'm going to wrap the leg in vet wrap, starting at the toes, and again moving proximally as I progress up the leg. I need to overlap 50% of the bandage as I apply. Alright, next I'm going to apply a large splint onto the leg that's fitted. And then I'm going to apply the stirrups over the splint. Then I'm going to bandage it. Next I'm going to take this tape and tape in the splint going all the way up the leg. Okay. Wrap the splint now with gauze all the way up the leg. Next I'm going to take the bandage scissors and remove the completed splint. Okay, so I cut all the way down the back of the leg, and then I'm just going to remove the splint, and I'll just cut the rest of the bandaging off. Okay. Okay. Okay.
Down, down, down. Oh, yeah, click that. That's good. This.
That's all right.